All right, so give us an idea of how big of a breath you want everybody to take over the proposed COVID-19 ordinance and what it meant for the health department.
Yeah, I think one of the supervisors tried to explain what the ordinance was trying to address. I think there is a challenge that the state statute, the Supreme Court ruling negating safer at home and the state not coming back to address the challenges with the pandemic ended up leaving the enforcement up to each and every county. And so the ordinance tried to address an issue. It was as it was put out there, it is clearly a proposed ordinance, and we were working with various entities to get their feedback and input. And at some point, meaning on Monday, when I had a meeting with the WCA said they were having some of these same challenges in multiple counties throughout the state. And so they decided and opted to put together a work group that includes multiple parties and multiple interested entities, and bring in the professionals and provide some guidelines as far as what would be best practices if a county were to look at not only a specific ordinance about COVID, but also under potentially infectious diseases.
Yeah, exactly, because I think that's one thing that really probably puts some fear in some people is the kind of open-endedness of it, saying infectious diseases. Does this mean that we're going to be under under lockdown because of one or two people in the future?
Sure. There was a lot of feedback that was gained, a lot of input that I've received, a lot of discussion by citizens. I've received in probably 36 to 40 hours, well in excess of 160 different contacts with constituents throughout the county and entities, and so I welcome all of that input. And I seen a need for us to look at this proposed ordinance in its entirety, and so felt that my recommendation to send it back to committee, wait for that work to be done, and look at a ability to communicate and allow the public to provide their input when and if a new draft ordinance is brought forward. Now, in Marathon County's ordinance, it was not an infectious disease ordinance covering all infectious diseases. It was targeted at one specific infection out there, and that's COVID-19, the pandemic that the county is and the nation is under, and the world. But the issue that the Supreme Court raised is multiple faceted and potentially extends past some of the powers that are in the state statute that the health officer currently has.
Then the other thing that was brought up by one of the supervisors was this ordinance, really the target of it is to find a way to keep people from knowingly going out there and spreading the disease, correct?
Correct. The intent was to address individuals or businesses that willfully tried to not obey any orders that were put in place, and knowingly spread the potential disease.
Then that kind of is an example, I guess, of the state of confusion that we're in right now, since the Supreme Court tossed the safer at home order and really basically opened everybody up within a 5-minute window. So we're still kind of sorting through some of these things.
That's correct. I think that's exactly what WCA, Wisconsin Counties Association, seen is some deemed it the wild, wild west. You have one set of rules in one county and a different set of rules in another county. And so I think the WCA saw fit that to bring all of the interested parties together and come up with a general consensus, best practices, so that we could have potentially at least a uniform set of facts at which to be able to potentially, if a county chose, to draft an ordinance moving forward to try to keep its citizens safe from the spread of potentially dangerous diseases.
Then one more, you also recommending the extension of an emergency order through the end of the year, correct? Just again, give us an idea of what that's about, because I understand it's largely tied to financial gain for the county and potential gain as well if there's another stimulus package.
There's really two things that I would say that the emergency order extension, declaring the COVID-19 emergency extension that I'm really aware of. One is it suspends the county's procurement code for acquiring assets. We would not necessarily now have to go out for bid if the purchase were going to be, or the contract was going to be in excess of $30,000. And now, as you've heard, we've had, in most cases, we continue to use our procurement code. It's only if there's an emergency that arises that they absolutely need, and the necessity is of such urgent need that we can't go through a 3-month process waiting for bid, that we need whatever that may be. Maybe it's PPP, personal protection equipment, PPE, or something else. But in this case, that allows the county to avoid utilizing the procurement code that is in our ordinance. But the other thing that it does is, in some cases, some of the federal grants, federal monies, and in fact some of the state monies are tied to whether or not there's a declaration of an emergency, and because of that, if we were to allow the emergency to expire, knowing full well that COVID has not been eliminated and that the COVID-19 is still relatively no treatment and no vaccination for, that it would be irresponsible to the taxpayers if we would lose out on access to funds or need to go through a 3-month process trying to acquire something that was needed in an emergency.
So it's not, necessarily about controlling when businesses can and can't open. It's really kind of to help out the bottom line.
That's correct.
Right.
That's correct. It has, there'll be a more in-depth report provided to the county board next week when that is brought forward, as far as detailing all of the issues that the declaration does provide for, as far as the county moving forward.
All right. Anything else we should know then before we let you go?
No, I think you've got everything that I've got for today.
All right. Sounds good.